Management of suspected LVADI. Hello. Today we are reviewing the clinical management algorithm for a suspected left ventricular assist device infection, or LVADI. This systematic approach is crucial for timely diagnosis and effective treatment. Step 1. Initial assessment. The process begins with a detailed history and physical examination. You should immediately order basic laboratory tests and blood cultures. Depending on the clinical presentation, consider driveline cultures and pump pocket imaging to pinpoint the site of infection. Step 2. The critical junction. The management pathway then diverges based on the blood culture results. If blood cultures are positive, or if the patient has had recent antibiotic use that might mask a positive result, the next mandatory step is a transesophageal echocardiogram, or TEE. Step 3. Positive blood cultures pathway. If the TEE is positive, we are likely looking at CIED lead vegetation or VAD-related endocarditis. These cases require surgical consultation, device removal where applicable, and a minimum of 6 weeks of antimicrobial therapy followed by chronic suppression. If the TEE is negative, we must investigate other sources. This could include a central venous catheter-related bloodstream infection, a CIED-related infection, or a pump and cannula infection. Treatment will range from removing the infected device to surgical debridement and long-term antibiotics. Step 4. Negative blood cultures pathway. Now let's look at the pathway for negative blood cultures. In these cases, we focus on localized infections. First, for a CIED pocket infection, the device should be removed, followed by a 2-week course of antibiotics. Second, for a VAD driveline infection, treatment involves 2 to 4 weeks of antimicrobial therapy, with or without surgical debridement. Note that routine chronic suppression is usually not necessary here. Finally, for a pump pocket infection, surgical debridement is required, followed by 2 to 4 weeks of antibiotics and chronic suppressive therapy. Conclusion. By following this structured algorithm, clinical teams can ensure that every suspected LVADI is managed with the appropriate level of surgical and pharmacological intervention. Thank you for watching.